Hi, I'm Dr. Peter Leung. Okay, I'm one of the obstetrician gynecologists working in the Sand Hospital, and I'm also the consultant as well as the clinical director in IVF Australia as well as the Fertility Centre Liverpool. Today, I want to share some experience with you in terms of how to manage problems with ectopic pregnancy. Now, ectopic pregnancy is actually a very important topic for obstetrician and gynecologists, in particular for fertility doctors, because sometimes the patients coming to the fertility clinic is because they have a tubal disease. That means the tubes is actually diseased and having an issue, and so they are at particular high risk of developing ectopic pregnancy. Now, to us, the ectopic pregnancy just means that the pregnancy is not situated in the right position. Normally, the pregnancy should reside inside the womb itself, so that when the pregnancy grows, the uterus can encompass the pregnancy to allow the proper growth of the baby and hence the subsequent delivery of the child. Unfortunately, in a situation of ectopic pregnancy, the pregnancy itself is lodged on abnormal places. Most commonly is in the fallopian tube, but sometimes can be in very odd places as well, including the ovary, the rest of the tummy, or even very remote sites. The patients having ectopic pregnancy is potentially having a life-threatening condition because the ectopic is situated on the abnormal site, which usually means that the organ itself cannot encompass the growth of the pregnancy. So if you leave it unchecked, the pregnancy would usually end up in a catastrophe where there would be internal bleeding happening, and sometimes this condition can be life-threatening. So it is of paramount importance that we recognize the issue of ectopic pregnancy in a timely manner, because this is one of the potential complications that can have life-threatening consequences for a potential pregnant patient. Patients sometimes can be asymptomatic with ectopic pregnancy, and that's why in patients in particular high risk of developing ectopic pregnancy, we sometimes ask the patient to come up to have early assessment, while we will be using an ultrasound scan at around 7 to 8 weeks of gestation to locate where the pregnancy is. Now, obviously, if we can see the pregnancy inside the womb, then the chance of having ectopic pregnancy will be much lower, in particular if this is a natural conception. However, if we can't see the gestational sac inside the womb, then we need to exclude the chance of ectopic pregnancy. And this sometimes would entail further monitoring by using a serial blood test or subsequent ultrasound scan to locate where the pregnancy is. Sometimes if the patients presented late in ectopic pregnancy, they can have abnormal vaginal bleeding, they can have sudden abdominal pain, and in the worst case scenario, they can be found to be collapsed with a very low blood pressure and come in a shock condition and presented to the casualty departments. So in those conditions, then obviously it's becoming a gynecological emergency, and this is one of the important diagnosis to exclude for pregnant lady presenting in such symptoms, and so they often need immediate surgical treatment to stop the bleeding. If the patient is diagnosed early, sometimes there are other avenues that we can explore to manage the ectopic pregnancy. This could include potentially salvaging surgery, where you can use what we call a keyhole operation to put in a laparoscopy to look at where the pregnancy is, and sometimes just removing the ectopic pregnancy itself and preserving most of the other internal organ, including the possible fallopian tubes as well. The other possible treatment options available for patients with ectopic pregnancy is through medical treatment. Nowadays, there are options for the patient, if they are not presenting with acute bleeding problems, to use systemic medication to kill off actively dividing cells, which then at the same consequences would kill off the ectopic pregnancy. So those medications are quite useful in relieving patients out of the ectopic pregnancy over 90% of the cases. Last but not least, once it's being treated properly with the ectopic pregnancy, the patient need to be counseled towards what's happened and how to prepare them for the subsequent birth or subsequent chance of pregnancy again. As we all know, once you have a history of ectopic pregnancy, some of the patients would have increased risk of developing ectopic pregnancy again in their future pregnancy. So it's actually of paramount importance to remind patients to have early access to antenatal care. And once they have diagnosed with the pregnancy, they should see their doctors early in order to locate where the pregnancy is. Because of the increased risk of ectopic pregnancy, sometimes we also ask patients to be mindful about using certain forms of contraception. For example, the use of intrauterine devices or the use of progesterone-only medication may be relatively contraindicated in those conditions. So it is also important to discuss the contraception needs for you together with your managing doctor so that they can pick the best options for you. Nevertheless, for patients having ectopic pregnancy, if they wanted to have a baby in the future, they might have an increased chance of developing infertility as well. So that's why in the infertility practice we have an overrepresentation of patients have history of ectopic pregnancy before. Now, even though that there was a significant problems with tubal diseases, there is still a chance of achieving a pregnancy through assisted reproductive technology such as use of IVF, where we can actually get the eggs and sperm outside the body, create an embryo, and put it back inside the womb in the hope that this would bypass the blocked fallopian tube, which may be the consequences of having ectopic pregnancy in the past. So it is also important for you to think about these options as well, in case as you are troubled by the history of ectopic pregnancy and are never able to achieve a pregnancy through natural means. So hopefully this is all useful to you guys, and I hope that that would clarify some of the issues surrounding the topics of ectopic pregnancy.